I'm Norm Stillman from the Court Street Animal Hospital in Plymouth, here for this week's PCN Pet Health segment. This week I thought that Wicklow and I would explain to you what exactly is involved in running blood work on your pet. Sometimes you may take your pet to your veterinarian and they may request the permission to pull some blood. And I thought I'd explain to you what exactly we're looking for when we take blood from a pet and show you an example of a blood chemistry and a complete blood count to help you understand the importance of each of those tests. Blood is mostly water, and floating in that water are a lot of different types of cells: red blood cells, white blood cells, platelets. Also dissolved in that water are a lot of different chemicals, and some of those chemicals have significance for certain organ systems or body functions. So when we're doing a chemistry and a blood count, we're looking at two things. First, the chemicals dissolved in the blood and what they tell us about how the kidneys are working or the liver is working or whether a cat has diabetes. And then we're looking at the types of cells that are floating in the blood, their ratios of one to another, and the total numbers of them that are in the blood tell us whether the cat maybe has not enough blood in him or whether he's fighting an infection, and sometimes it tells us what type of infection he may be fighting so that we can choose the appropriate drug. Here's an example right here. So here's a chemistry which has a lot of different tests. Each one of these tells us a little something about a certain organ system or body function. And then here's a blood count that tells us all the different types of cells that are in the blood and their ratios of one to another, so we can decide what the source of an infection is. And with that information in hand, it usually makes it much more simple for us to figure out why a pet is behaving the way they are, why maybe they're not feeling well, and of course what we can do to rectify that. Thank you so much for the opportunity to show that to you on this week's PCN Pet Health segment. I hope I'll see you again soon. So long.